So let's talk about the users of the health record. The number of organizations and individuals who legitimately need access to confidential patient information has grown as the healthcare delivery system has become so complex. Physicians, psychologists, nurse practitioners, nurses, allied health professionals, and other healthcare administer clinical services directly to the patient need information or need access to the information. Staff working in administrative and non-clinical roles support healthcare providers, and they have a need to use the health record. During a short hospital stay, dozens of clinicians, ancillary staff, administrative staff, and support staff will access the information in the patient's health record. The processes that make health record information available is legitimate users are known collectively as release and disclosure. Release of information, you may hear it ROI, is another term to describe disclosure of a patient information. The processes or the processes that's used to store the health information and to destroy it when it's no longer needed is called retention and destruction. That development of electronic health record has given healthcare organization the ability to retain and store health information without the physical space restricted of paper-based health records. So these processes are subject to specific regulations in many states. Federal regulations and accreditation standards also include specific guidelines on the release and retention of information of patient health information. The main users of the health record are the clinicians responsible for direct patient care. They are the ones that's authorized to document and assess clinical information for the patient to whom they provide services. Most clinicians are only authorized to access the record of their own patient, so accessing and disclosing health information without valid reason is considered a violation. The Office of Civil Rights, OCR, is responsible for enforcing the HIPAA violation and does so through voluntary compliance, corrective actions, and or resolution agreement. The American Recovery and Reinvestment Act of 2009 developed penalties for HIPAA. So the civil monetary penalties for each are listed here. So they not to exceed $100 for each violation or $25,000 for identical violation during a calendar year, beginning in January with an annual maximum of $1.5 million. So this is a lot of money. So people want to make sure that when they're accessing or looking at information, they need to make sure that they have a need to know. For criminal HIPAA offenses, the Department of Justice, the DOJ, handles these cases for disclosure of individual identifiable health information. So the criminal offenses are categorized in 3 types of offenses, and we're going to talk about these next. So let's get into them here. Reasonable cause and not due to willful neglect. We can see here is to prove reasonable cause. The covered entity or business associate knew or would be expected to reasonable know that a specific act or omission took place, yet the covered entity or business associate did not willfully neglect this action. The second one is willful neglect, but the violation corrected within required time period. So to prove willful neglect, the covered entity or business associate must make a conscious and an intentional action. And then the third one is willful neglect, but not corrected within required time period. When the conscious or intentional action continues and there was a disregard of any time frame imposed for correcting the action, then this third type of offense occurs. An example of willful neglect is an individual selling other individual PHI for personal gain, or a hospital employee gathering the disclosure of PHI with the intention of selling it for personal injury lawyers, or selling it to personal injury lawyers. So let's talk about the definition of a health record for legal purposes. The legal health record can be defined as the official business record used for evidentiary or evidence purposes created by or for the healthcare organization. The legal health record is the portion of the health record that will be disclosed upon request to parties outside the organization. It serves to support the decision made in the patient care, support the revenue sought for from third-party payers, and also to document the service provided as legal testimony regarding the patient illness or injury, responses to treatment, and caregiver decision. And it also serves as the organization, business, and legal record. Now, until the use of the computer technology became widespread in these past 20th century, the definition of a legal health record seemed relatively straightforward. So the content of the paper-based health record became the provider's legal business record of the service that he provided or she provided. Defining the legal records become complex for organization with EHRs, and the capabilities do not exist in the paper-based records. So for example, you could have multiple versions. You could display information in multiple ways, and there can contain features such as alerts, reminders, and they provide clinical decision support. That's what they're there for. Because these functions are not available in a paper-based health records, the health care organization must determine which part of the EHR includes or included in the legal health record, or which part of it they will exclude. So of course, there's no one size fit all in the definition of a legal health record, and there's no one size fit all for a designated record set. So the law and regulations governing the content vary by practice setting and state. So each organization must consider individual state laws, federal laws, accrediting agency standards of care, and requirements of third-party payer. That permits the health records to serve and represent the legal business record. So let's talk about the information that constitute the legal health record. So the challenges for HIM professionals in defining a legal health record or a designated record set determines which data elements or electronic structured documents, images, audio films, videos that will be part of the legal health records. So the HIM driven team of patient care members can can use several or can have several considerations to go by when they're trying to identify what part will consist of a legal health record and a designated record set. So each facility needs to determine how new documentation application will be interpreted in relations to the facility's legal health record. So there's various types of patient identifiable source data, which is collected and stored in source systems. Source system data must be evaluated for inclusions in the legal health record. Source system data are the data from which interpretations, summaries, notes are derived. And so an example of source system data are radiology films or scans, laboratory values, pathology slides, videos, and audio recordings. So there's two types of administrative information that's created and maintained by the healthcare organization. The first type consists of documentation that is typically part of the health record, such as contents for treatment or surgery, and research forms that would be produced in response to a subpoena. The second type of administrative information should be considered part of the legal health record will not be produced in response to court order or subpoena or request of health records, and that provides no means of identifying specific patient. These data source or data types should have the same legal level of confidential as the legal health record. However, derived data should not be considered part of the legal health record and would not be produced in response to a court order, a subpoena, or a request for the health record. This ends this part of our lesson where we talked about types of different types of legal purposes that and how we define these in a health records. So we would pick up our next section where we talk about personal health records.